Welcome to the Nervata podcast for complex health. We feature expert guides who dive into ancient and cutting edge understandings of health and disease. These conversations are about food, lifestyle, and medicine just as much as about nature, culture, and politics. I'm Jillian Ehrlich, family nurse practitioner certified in Ayurveda and functional medicine, coming to you from our clinic, Nervata Health, in Seattle, Washington. And I'm very excited to share with you one of our newest practitioners today. She has joined us. Khairul Bhagwandin has a master's in East Asian medicine from Bastyr University, which includes herbalism training. And as well, she's a licensed massage therapist. She specializes in holistic and regenerative beauty, offering treatments that support the body's innate healing systems. She's been named a Seattle Met Top Acupuncturist for the last 3 years and is currently launching her own herbal skincare line, Khairul Holistic Beauty, which blends traditional Chinese medicine with hyper-local ingredients sourced from her family's farm in Southwest Washington. That's actually how we originally know each other. I've been friends with her mom, who's been part of the Ayurvedic community for decades now. Outside of her practice, Khai lives life adventurously, snowboarding, mountain biking, climbing, and fire dancing, as well as making music with her band. She's also the founder of the Change Collective, an organization she launched in 2021 to advocate for marginalized communities in snow sports. So much going on, so much to impact. Khai, we're so glad you're here. Welcome.
Yeah, thank you. I'm happy to be here.
Yes. All right. So let's dive in. So, this is a show about aesthetics and beauty, which I know about. I mean, I've always been a medical person. And so I know about beauty and aesthetics as much as I know about like space travel. Which is to say, I see other people doing it and I don't totally understand it or how to even to think about or conceptualize kind of the components of it. So, talk to us about like a natural and healthy approach to beauty that like isn't necessarily tabloid driven. What is it to be beautiful? And I know that this is, we could spend like a week talking about this, but talk to us about like how do we conceptualize our beauty if we don't have like necessarily a perfect feature?
Yeah, totally. So, yeah, I think most people think of beauty, the way that people think of beauty is a social construct, right? To me, beauty is a reflection of our internal harmony. And in Chinese medicine, TCM, we talk about the shen or the spirit,
Mhm.
which the body is made up of the mind, body, and spirit. Shen is that spirit. It's like the sparkle in your eye. It shines through in your personality, in your voice, and it shows up in our complexion and on our skin. Well, beauty in the context of what I do um, is really looking at our interaction, how we see each other, that first visual impression, and really looking at the skin, which is our interface with the outside world. So, it's how we feel sensation, temperature, it's our protective barrier, it's our social interaction and our self esteem. And it's really a window to what's going on inside the body physically, but also psycho-emotionally. So when I talk about beauty, it's really looking at healthy skin and healthy whole body wellness, and that is what shows through as beautiful.
It is beautiful. It's like you saying that is like beautiful. And so how do we contrast that with like because I feel like so much of beauty is I don't know, not beautiful. Like so much of beauty is about like what your face does or like what it looks like or taking your face away and adding other features. Like how do you think about that?
Yeah, so exactly, and that's kind of like it's like covering up, what is on the inside and like, adding Botox or fillers, it's like or even just like, covering up we're really covering up the symptoms that we're seeing inside the bodies. And beauty is different to everyone. So it's like I'm not saying like I want people to express themselves and like feel confident in their skin and who they are. So for me, it's really just like we're not like chasing this flawless skin. We're looking for healthy skin. And I think you can really see that in a person, but it's also, deeper than that. It's like how we interact and you can see like you really can see someone's shin when they walk into a room. It's like they're like glowing or just they light up the space. And that's where the word beauty, I think it means a lot to different people, but that's the approach that I come from.
Nice. It's so nice. And so what does this mean treatment-wise? What makes, like, a beauty treatment healthy or natural? Yeah, what are the components of treatments that help us get there?
Yeah, so healthy treatments really balance the skin function and the whole body. So it's not just this surface level thing. The surface level is kind of covering up signs and symptoms of what's happening deeper in the body because our skin is kind of like a check engine light so we can kind of see what's going on inside
Uh-huh.
and we don't wanna cover that up. So, natural treatments work with your own body's innate healing system. It's activating the chi and the blood circulation, activating your own collagen and elastin production, and then also supporting internally by addressing like any root causes if we're treating like a specific condition using proper nutrition, herbs, supplements, even IV therapy if it's needed. And then also the other component would be looking at the psycho-emotional influences and environmental factors like we're exposed to pollutants every day. And that's something we kind of have to mitigate. So, just making sure that all of our systems are functioning the way that they're supposed to be functioning. And then, yeah, as far as ingredients goes, like you would be surprised, or maybe you wouldn't be surprised how many chemicals, toxic things are in our skincare products.
Yes.
So many petroleum-based ingredients, formaldehyde, artificial fragrances, which are what most people are really sensitive to, and even unscented products have something in them to cover up the natural scent of the product. There's this difference between fragrance-free and unscented, and it's all kind of confusing, and, brands are held it's just based on this capitalistic structure where the consumer ends up being suffering. And, these brands actually are obligated to their stakeholders to increase profit. And so they're just, not really paying attention to what is actually good for us, unfortunately. And we see a lot of this with hair products too. Like there are a lot of brands that are currently have active lawsuits against them for having ingredients that cause hair loss. And these are like
Wow.
big brands that we use every day, like, Tresemme, Olaplex, Unilever, Dove, Bedhead. Like these are like brands that I have used.
Wow. Yeah. Yeah, that's shocking. That's amazing. I mean, that's actually really good to know. What are the ingredients that cause hair loss, or how does that happen?
Yeah, so there are, a lot of ingredients. I actually have, a list, and I
Mhm.
always that's kind of like what the first thing I do with my patients is when we do a consultation is going over their products, like what
Mm.
you using and how do we, look at the ingredients. I mean, you always have to look at the ingredients of everything, even what you eat and put in your
Yeah.
body. So really like helping people and training people how to recognize, like, what are these because 'cause they're hidden in there, the great example is, like, unscented versus fragrance-free. It's like these things are hidden in the label, so you have to kinda decode it a little bit. And a good place to start is, like, if it's a brand that doesn't have these chemicals, they're gonna tell you. So,
Mhm.
I like to start there and, like, I have a list of brands that I trust, and then that's kind of a working list too, so I'm always happy to add to that. And yeah, I think that's the easiest way to kinda go about it is, like, if it's a good brand, that's part of their branding. They're gonna tell you, "This is non-toxic, this is paraben-free, this is" they'll tell you. And yeah, there's not, like, a lot of regulation with that, so you still have to kinda decode a little bit, but I think that's the easiest approach as far as, like, the common person, like, trying to buy something. Um, yeah.
It's such a wild thing to have to think about. We know that it's actually more expensive to use ingredients that are less toxic, which is wild to think about that it's easier to take things that don't exist, make them in a huge plant or facility, and then put them in these products for mass sale than it is to kind of harvest things naturally out of the earth and then just put them into a product.
Mhm.
We live in a crazy age.
Yeah. Well, and I think it's also, like, worth mentioning here that, like, our health is directly tied to the environment. So,
Mhm.
a lot of these brands are polluting the air and the water, and that directly contributes to the detriment of our own health.
And our children's health and our legacy. It's
Yeah.
wild. Yeah. Yeah. So start us like walk us through kind of one of your consultations. And I suppose we can kind of do this in two ways. Like we could talk about like a list of your services, like from simple to most complex, or we could start with like a consultation. And you can talk about it any way you like, whatever you think is going to be best for us to listen.
Okay. Yeah. So, I'm really blending the traditional Chinese medicine and then, like, functional medicine principles and modern aesthetics. So I offer, a comprehensive, like, deep dive into, like, your skin condition and how we can get the results and meet the goals that you wanna meet. That's gonna be much more involved. And then there's, like, people that already have, their dermatologist, they already have sorry, the sun is like
I know. I
yeah,
know. You are like in a cone of light
I know,
here.
I'm like, it's
Amazing.
slowly shifting over. So, there's people that, have an esthetician, they've had a lot of treatments, they've have a dermatologist, their skincare routine is super dialed in. Maybe they've struggled with issues in the past, but now they're like good and they just want to experience an acupuncture facial. And I'm here for that. I'm totally here for that. Like that is great. Come in, see me, let's do a facial. I can give you some tips here and there just from a Chinese medicine point of view. But if you want to really get results, specific results, and we have goals, then that's where the, more in-depth consultations go. And then as far as services, I do facial acupuncture. I do facial cupping and gua sha, which is really amazing and very accessible, something you can do at home with tons of benefits, including like brain health. So we can talk about that more later too. And then I also do microneedling and nanoneedling. So microneedling is where we're using needles to stimulate collagen and elastin. And it's actually based in Chinese medicine. They used to have like these derma rollers, which people probably have heard of. So this is a more modern technique where we're using and oscillating and triggering that collagen elastin. And then we're also using serums, which basically you can get those serums deeper into the skin because we're opening up these micro channels. And so that treatment is really all about the serums that we're using. And I use plant based Chinese herbal medical grade exosomes. So, yeah, so we get that Chinese medicine influence. Those um, stem cells and exosomes actually trigger your own body's stem cell production as well as the herbal ingredients, depending on like, it's individualized for each person's skin. So I'm really looking at like, what does my patient need? And what are their goals? And we kind of build that out there. I also do injection therapies, so mostly for scar treatments. I use Procaine, which Procaine is it does have, like, an anesthetic property, but what I really like about it is that it basically dissolves the scar tissue and realigns the cellular matrix, allowing for to reestablish the, like, interference field that's been created by the scar. So it does have an aesthetic, like, effect. It's not gonna make the scar go away, but it's going to return the tissue to its normal healthy function, and that's what we want. So, especially for people who have had surgeries like C-sections or top surgery, stuff like that, it can really release a lot of that restriction and, you know, return the cellular communication so it can have effects on the whole body from just releasing scar tissue.
Oh, that's fantastic. And it's very true. We've been talking more and more about how it's the systemic milieu that really governs kind of our direction towards longevity, or our direction towards aging or inflammaging. And to have that systemic milieu, science is now, research is looking at how many molecules, including exosomes in the body, like these nano vesicles that carry essentially communication information, how much communication there is throughout the body at all times. Ayurveda talks about that, Chinese medicine talks about that. And so when we're looking at that systemic milieu, part of that is you have to be able to have those communications and or have those molecules and those communications. And a scar is something that is going to interrupt that flow. And so that's amazing. I didn't think about that, but you're exactly right. If you're looking at kind of the original boundary of our bodies as our skin, then allowing communication and flow across that whole boundary is going to be integral to healthy communication and healthy systemic milieu. So
Yeah.
fascinating.
Yeah. Yeah, and that's, like, kind of the basis behind, like, neural therapy, which uses procaine as well, and actually acupuncture points, so you can inject into acupuncture points to kinda help release any type of blockage, full systemic effects. It's kinda cool too because then you have this little, stimulation of the acupuncture point that kinda sits there over time, so it can extend the effectiveness of acupuncture, so especially for people that, like, can't come in a lot, and I use that a lot for more like my pain management patients, but, that can have a really great effect and just allow the treatments to work better and last longer.
Mm. Mhm. It's fascinating. It's fascinating. And so is that kind of like I've always seen, when they do the points on the ear and they put like a little stone there. I don't know what it's officially called. I'm sure it's not called a stone, but it's like, it gets taped onto the point and you can kind of push on it.
Yeah, the ear seed. Yeah, those are great. Actually, I've just been looking at a new technique where they have these like semi-permanent ear seeds, which are like almost like jewelry and it's like a little needle that sticks in and stays there. I use it a lot for athletes, but I've been really curious and I think I'm gonna try and bring that in. But the seeds are great too. The ear is like a microsystem, kind of like the bottom of the foot with reflexology, where we can influence the whole body just through the ear points. Um, and they're actually the most studied acupuncture points are on the ear. They've totally brain mapped all the ear points.
Amazing. So cool. So cool. We used to, when I worked at the medical respite, we had a lot of patients that were involved with the methadone program. And so methadone is if you have an opiate addiction, can actually be really helpful to have a steady level of opiate in your body, which is methadone is a very long acting opiate. But so you would have to go every morning essentially to this place and get dosed. And they also did acupuncture there because the majority of clients who require methadone or have struggle with opiate addiction also have so much trauma. And so if you're not able to treat that trauma, then, people are really continue to be so stressed and seek relief from that stress in any way possible. And so a lot of them would go down for their methadone treatment and come back with those ear seeds.
Yeah,
Amazing.
there's a whole protocol for addiction, which I actually use a lot for just calming the nervous system down because
Yes.
I use the ear points in my treatments all the time just to, like, get people to kinda down regulate so that then when I do the rest of the acupuncture, it's not as, like, jarring, and it's just, like it's really good for treating sleep too, anxiety, depression, and those are, like, the pieces of, like, addiction, right? It's, like, the reason when we're getting with drugs, it's like you get this anxiety that you have to, like, feed it, right? And so treating that, and then a lot of times we have sleep disturbances and see a lot of other, like, nervous system things that are we just need to kinda down regulate.
It's so fascinating. I mean, I love working with patients or clients with addiction just because I feel like it's the unspoken reality of all of our lives. We all have addictions, but sometimes people have addictions to their lower grade or they're to exercise or cleaning or things or work, even things that are like deemed acceptable, but that drive from the inside where you can't necessarily stop it. You think about it all the time. And when you don't have it, you get very anxious or you're not doing it, you get very anxious. I think that, all of us that's kind of that core of desire that drives suffering is very exposed in a population that's like, I'm doing air quotes of like labeled as addiction or substance misuse or, but I would say, all of us struggle with that. I mean, I know I do with so many things.
Yeah, totally, and, that's to kind of reel it back into, like, natural aesthetics, like,
Yeah.
we hold all of that tension in our face and, like, a lot of it is just, like, releasing the anxiety and the stress so that you're not holding all of this tension in your facial expressions. When we get the 11 lines, we call those the liver lines, and that liver is like affected by stress in Chinese medicine. So that's like our frustration, our anger, um, or just, like we hold our face in these positions for so long, then we start to get these deep wrinkles, or you can see that show up on your face. So just relax. I mean, I think I could probably just do the ear points, and that would would be enough for some people.
But my dad told me if I continued to frown, my face would freeze that way. It's true.
It is true. He was right.
He was right. Oh my god, it's fascinating. So I love that you're working in I mean, your perspective is so holistic, Kai. Like, the idea that you're working in about that addiction piece as you're working to calm the nervous system, as you're looking to kind of unlock a person's inherent beauty is pretty brilliant strategy. Well done. So let's talk a little bit about so you can come in and kind of have a facial. Like, you can kind of just have a facial, like, be relaxing, be relaxed, be pampered. You do in that treatment, you're doing acupuncture. What else are you doing in kind of a relaxation facial?
So, it kind of depends on what what the person wants. We can do a 30-minute just quick facial where we're doing some gua sha, some facial massage, maybe a face mask. Or you can come in for the 60-minute acupuncture facial. I also integrate like a light therapy. So while you're sitting with the needles in your face, you can get the light therapy over your as well, which has a lot of great benefits with inflammation and collagen production. We can also extend that if you want a full 90-minute and kind of combined the, gua sha facial with the acupuncture, which is really nice. That's my favorite thing to give because you just don't feel as rushed and we can kind of do everything. And then there's the microneedling and the nano needling, which we kind of talked about a little bit. That is a little bit more involved. So we do need to do a little bit of prep. There is a little bit of downtime afterwards. So we just need to make sure that we're doing the proper aftercare. There's the injection therapies. That's pretty much like the tools that I use. And then if we are working on a specific condition or goal, then we do want to be doing multiple treatments over a period of time. And kind of figuring out what's going to work best for your goals, and that also involves the consultation. So we're looking at a holistic skin analysis. We're setting our goals, figuring out what our treatment strategy is going to be. We're going over our home routine. We're looking at the products that you're using and making sure we're cutting out any toxic things or anything that's causing reaction. We're looking at cross reactivity. We're looking at the digestive system. We're looking at all the functions, the liver, making sure that we're getting rid of toxins correctly as well. And then we're building, if you don't have a system that's already working for you at home, we figure out what's going to work for you because it's those consistent little daily actions that give us long lasting results. So a lot of people will come in and be like, "Oh yeah, I splash water on my face and that's it."
Yeah.
Just
I mean,
like
I do use a face cream. That's what we were talking about yesterday. I
yeah,
splash
so it
cold
goes both
water.
ways, and figuring out, like, what works for someone's busy schedule too, or if it's somebody that's like, "Oh, I really enjoy the ritual of doing, like, my gua sha routine before bed and putting on, like, multiple layers of skincare," and that's just, like, a way for me to, like, meditate and connect with myself. So there's there's so many levels of what people have time for. I think minimum we want to wash and put on uh, a lotion. That's our minimalist routine. But then I also have the use of a genomic assessment, which is really fun to look at. So, really looking at the gene expression. So, based on your past history, we can see like what you've been exposed to, because of like different lifestyle factors, we actually um, turn on and off different genes. So I can't change your genetic makeup. You're always gonna be predisposed to certain things, but we can't influence how those genes are expressed. And so I just use a super simple, saliva test, and we can look at factors that directly influence the skin. So that's going to be your diet, vitamin and mineral support. So looking at how your body utilizes different nutrients, looking at the skin barrier function. So kind of looking at our tendencies towards like dryness, rosacea, eczema, hyperpigmentation, stuff like that. And we're also analyzing your connective tissue and how we can support that. And then your capacity for collagen and elastin, resilience and glycolation. So that's kind of like a really deep dive as far as like, okay, maybe you've tried like a lot of different things and we just can't figure it out. Or maybe you just want to optimize your current skincare routine and treatments. And then we can really look at like what we need to add as far as supplements specific to your genomic expression and really get results, right? It's like a results driven path.
And what's the testing that you use?
I use it's called Spotlight on Skin. Yeah, it's a genomic test.
And it's looking at how does it look at, like, genes or gene expression? How does it do that? What's being measured? Maybe I'm getting too detailed.
Yeah. So, yeah, I think I would, it's looking at the SNPs basically. So it's looking at the gene expressions. And then it has different categories based on like, how is your skin utilize vitamin A, D, zinc, B vitamins, and based on like how your past history, or maybe you've been exposed to different chemicals, or maybe you've had your diet is like aggravating things and causing these SNPs to like turn on and off. And so we can actually look at those gene expressions and
Got
analyze
it.
those based on very specific, like to how these are influencing your skin. So it is more like really honing in on the skin.
Huh? Fascinating.
Yeah.
Fascinating. So cool. I mean, we have a lot of as you well know, we have a lot of patients here who really struggle with their connective tissue, who have a lot of genomic connective tissue, either SNP mutations or sometimes we don't even find them, but a lot of Ehlers-Danlos syndrome or mixed connective tissue disease. And so that might be a fascinating read for a lot of our patients. And so when you're doing so I just want to go back to kind of like the structure so that people have a sense of like how to access your services because you definitely have like a lot going on. So, like, people can come for a 30, 60, or 90-minute relaxation facial that's going to be serums and acupuncture and gua sha. And then if people are doing like if they do a consult with you, how long is the consult?
So it's about 30 minutes. I also offer a 15-minute just free meet and greet. So if you like don't know where to start, or you just want to know more about my services and see if we are a good fit for each other, I think that would be the easiest way to start, because then I can kind of see like, okay, do you have any goals? And how can I push you in that right direction? And then as far as like the actual consult goes, that's a 30-minute, and that's where I'm going to have you fill out some paperwork, and we're going to look, I'll do some research as well. It's just the 30 minutes with you, but I'm looking at like your condition, and we're really figuring out like a comprehensive plan. Most all of these treatments are meant to be as a series. So, like a full series of acupuncture is 10 treatments once a week. And then from there, you can maintain. Ideally, you're doing something for your skin once a month. So every 4 to 6 weeks, we have a full like cellular turnover in our facial skin. So ideally, we'd be doing something, even if it's just the gua sha facial or an acupuncture facial, as far as like maintenance goes. But if you're doing microneedling, you want to do at least 3 treatments, probably more like 6 treatments, if you really want to see like the full potential of that treatment. We are working with your body's healing system, so we have to activate that, and then it's going to happen over time. So being patient and consistent is gonna be the best for as far as results go. So, yeah, I think the easiest thing to do if you're a new, patient is just to do the 15-minute consult, because then we can come up with a plan, or if you just wanna experience a, acupuncture facial, come in and do that, and we can kinda do our meet and greet during that too, and we can talk a little bit about what your goals are and if there are some other services that would be beneficial to you.
Got it. Got it. And so if you find, like, when you do the genomic report,
Mm.
how do you advise patients on how to treat? Like, are you giving supplement routines or what are some of the treatments that might come out of that?
Yeah, so definitely supplements. So we'll match you up with very specific supplements. I know a lot of people are already on like a lot of supplements. So I try and I don't want people to be on too many things. So some things we're like, okay, well, this supplement that you're already taking already hits these like points that we want to support. Sometimes we do want to be like, okay, well, maybe we should be doing an IV or therapy or something just to really boost up the system first. Herbal support, Chinese herbs, and then looking at for example, if someone is more acne prone, and struggling with that, then I'm gonna kind of shift them towards like the comprehensive acne program. So we're looking at also food support. So that's going to be a big one too, is like looking at what you can do at home, how you can change your diet. Is there like things that we can be doing at home that's going to support you as well, so we're not as dependent on supplements. We just absorb food better, and I like to go that route first. But yeah, definitely supplementation, and then it can also guide what treatments I'm going to be recommending for you.
And can you talk a little bit about, okay, so that's the full consultation and the series. How do you address specific questions? Like, how would you address like acne?
Yeah. So we it's really about looking at the root cause.
Mhm.
So we're going to ask questions. We're going to look at your history, your story, and we're going to figure out, there's so many different things there's hormone influence, there's food. Honestly, most of it comes back to food in the digestive system with pretty much all of these conditions. I'm just going to shift a little bit more into the shade here.
I
Um,
know, it's so cool. This is
it
very
keeps
light.
so yeah, it's like that's I would say pretty much with most conditions, we're looking at the digestive system. It all comes back to that like cross reactivity, and maybe you've been exposed to something and now you're sensitive, and now something else that kind of looks similar. Your body is like recognizing it as similar to what you were aggravated by, is now you're developing all these like multiple sensitivities. Looking at sugar is the big one, as far as like sugar
Yeah.
directly breaks down the collagen in your skin. And then, making sure we're doing exfoliating. I guess I forgot to mention, I also do gentle chemical peels. So that would be a thing I would recommend for someone with acne. And then it would also influence the serums that I'm using with the microneedling. So I'll use the herbs that are, more specific to what we call dampness in Chinese medicine. And that those serums are just so powerful. So sometimes I can get acne to clear up with just a few treatments. Sometimes if it's something that someone's been dealing with for a long time, or there's like a rosacea picture too, it can take a little longer. If there's yeast, sometimes with the yeast diet, it can take 6 months of correction before we start to see any change. So it's very individualized.
Got it. And how would you deal with the illusions over time, like without Botox?
Yeah, it depends on the severity. We're not looking for flawless.
Right.
And those lines too, it's like it shows our history, and like it's a privilege to age. So, that's also a thing. A lot of times with those, it is frustration. It's where we show our frustration or our worry. So addressing that, and then with acupuncture, we can actually release those muscles. So, releasing the muscle tension is going to be really helpful too. So, it's kind of a combination of things like diagnosis is a whole thing in Chinese medicine, and it's so interesting and so cool to see. There's different lines in our face for grief and sadness and worry and anger and all these different emotions, they show up on our face. So it's really about, resolving unresolved emotions and learning how to process those and learning how to let that pass through us rather than holding on to it in our bodies. Stress is like such a big thing. Like it's a healthy stress response is good. That's healthy for us. You want to be able to have a stress response, but it's when you're stressed for more than 30 minutes that it becomes unhealthy. So being able to ground and really be able to process those things in a healthy way so that we're not holding on to it forever.
Got it. Great. And then how would you deal? I know a lot of our patients, like with Ehlers-Danlos or connective tissue, a lot of their skin will lose that collagen and get very crepey, something that may not be amenable to fillers, or if people have a lot of sensitivities. How do you deal with kind of the like excessive tiny wrinkles about that?
Yeah, so that's gonna be like, honestly, it's the daily skincare routine that's really gonna be helpful for that. Also, gua sha, like, I really like to recommend things that are more accessible. Gua sha is so detoxifying. So, like, really getting, stimulating the fascia, stimulating the collagen, and also stimulating the lymphatic drainage. There's actually some really cool research coming out about actually detoxifying the brain as well with gua sha and with facial lymphatic stimulation, whereas like our deep lymph nodes reduce function over time as we age, but the face lymph does not. So we can actually detoxify our brain through lymphatic drainage through our face. So a lot of that is like those tiny little wrinkles. It's just like a buildup of metabolic waste and it starts to deteriorate, our function of the skin. So yeah, I would say sometimes less is more too. So I like to be really gentle with those type of patients, and it's something that we are doing consistent over time. So these little steps that really move us into the direction that we want to and integrating that in our everyday life. And acupuncture is just like I do all these other treatments, but like more intense treatments, but honestly the gentle acupuncture just does so much. I see really really good results with that.
There's one of my early acupuncture experiences was with my dear friend Anisha Derve. We grew up together in Cleveland, and then we were studying Ayurveda together and living together. And I came home and had like complete sinus congestion. And she was like, "Well, just sit down for a minute." And I was like, "Okay." And I sat on the couch and watched TV, and she came and put needles in my face. And in 20 minutes, all my sinuses like flushed open. And I was like, "What is happening to me?" And she's like, "It's acupuncture."
Yeah,
And
yeah,
I
there's so many acupuncture points on the face.
Amazing, amazing. And that's kind of the experience I had with you yesterday. So you did acupuncture facial for me yesterday, which was amazing. And it was really interesting because at about the 15-minute mark, I started to get really anxious and kind of restless. I had that feeling inside of me, like get up and run away. And that lasted for probably a full minute, which when you're laying still feeling that feels like an eternity. And then I felt like everything felt like it opened. I can't explain it, but it's kind of like when all of a sudden there's increased circulation through your whole body. Like my feet suddenly warmed, my hands warmed, like there was this just flushing feeling, not like inflammatory or redness, just like finally everything was getting the nutrition and nourishment and oxygen it needed. It was
Yeah, yeah.
relaxing. And I thought, okay, this is so interesting. So
Yeah, it's all about circulation. That's really what acupuncture does is like it increases the blood flow to places, and that's what you need to heal, and it brings oxygen and all the healing, nourishing things from the body to where it's needed.
amazing. There's these relaxation and facial acupuncture and gua sha and treatments. And then there's, this genomic assessment and kind of consultation and recommendations. And then in the middle, there's these treatments like how long is a microneedling appointment and how often should a person have that?
Yeah, so microneedling, we do use numbing cream.
Mhm.
So it's the numbing cream has to sit for 30 to 40 minutes. The microneedling itself is really quick, so that's a 60-minute visit. And you do want to wait 3 to 6 weeks in between because you want full recovery of your skin before you do the next microneedling. You can do acupuncture in between if you want or other types of facials. But you want to be pretty gentle and you wanna do at least 3 of those to really get results. Usually, it's more like 6. It depends on the person, their age. So 3 to 6 for that. Nano needling is similar, so we're using the same device, but the tip is different, so we're not puncturing the skin. No numbing cream required, no downtime or anything. That's just a 30-minute, visit. It's nice, like, if you're gonna be getting, like, some photos or something done, just kinda gives you that nice glow. Yeah, let's
And then
see.
the chemical peel, how often like, how long an appointment is that, and how often should a person do that?
Yeah, so usually with the chemical peel, I like to do that as an add-on because it is pretty quick. As a standalone, I would give it 30 minutes, but the chemical peels that I use are really gentle and it's actually time activated. So for someone who's new to a chemical peel, I'm only going to leave it on for like 3 minutes. Someone who's like more experienced or skin has already been, conditioned a bit, we can go a little bit deeper, a little bit longer. But yeah, I like to kinda combine that with either the acupuncture or with, like a mask or a facial. So, some of these things like the gua sha and the, chemical peel can be added on to a regular, acupuncture visit, and that's like that 90-minute is where we can do kinda multiple things. And, that is one as well, though, that you do want a little bit of prep. You wanna make sure that you're not using any actives or exfoliants a few days before and after. And then you do want to wait that full 3 to 6 weeks in between treatments for that one as well. Because basically, what the chemical peel is we're exfoliating all the dead cells off of your face. So we're really getting, those cells can provide a little bit of protection. So, we want to be gentle with the skin in between doing those type of treatments. But really good for, like, hyperpigmentation, acne, because we're actually getting that layer of dead skin off and bringing whatever we're treating up to the surface. So, for example, with hyperpigmentation, it's nice to do a couple chemical peels and then do the microneedling because then the pigmentation is already at the surface, and when we hit it with the microneedling, we're just gonna get a lot better results.
And how long between is recommended between the nano
Nano
like
needling, you can do that. There's no, it's kind of similar to acupuncture. It's pretty gentle. So, usually once a week is good. Also good to do it as a series. Needling is nice to kinda just pepper in with, like, other treatment series just to kinda give you a little boost. I also do nano needling for, vitiligo. So with that condition, we wanna be a lot more gentle. So we'll do a series similar to the microneedling, but we'll be using the nano needling tip. So we're still getting higher absorption of the serums that we're using. So we are getting it's less than microneedling, but for conditions like that, it's really important to be really gentle.
got it, got it. And then what can you talk a little bit about the products that you're using, and can you talk a little bit about your new line of Chiral Holistic Beauty products?
Yeah, so right now I have like a medical grade line which is the Noon skincare. It's botanical based, very gentle, but they do have a range of concentration. So they do have the higher concentrations of like those actives and exfoliants. They also are great for post procedure. So there's, certain products that especially after the microneedling that have to be approved to be but it's basically putting something on an open wound, so we have to make sure we're using something very healing and gentle. And then Chiral Holistic Beauty is my skincare line that I am developing and hopefully launching October 1st. So the concept is like kinda like farm to table, but for skin. So it's an herbal based skincare line where most of the herbs are going to be grown at my parents' farm, 65 acres in Southwest Washington. There's also some of the products are going to be wildcrafted sustainably on that farm too. So the property is really amazing. Have you been out there before?
I have not been out there. I've thought about it for years.
You need
No,
to
Sarah delivered Amelia there.
Yeah, yeah. Yeah, it's beautiful. So it's forested, most of it's forested, and then there's, like, some beautiful gardens, a big greenhouse. Everything's organically grown. We're not certified organic, but, we don't use any pesticides or chemicals. And, I've always wanted to do a product-based company, so the topicals is, like, a great way to kinda start doing that just because I do wanna do internal tinctures and stuff eventually, which I can do with my license, but it's just a little bit more of a process. So doing the skincare, topicals, and then I also wanna do more, like, medicinal, like, balms and salves and, like, first aid type of topicals as well for specific conditions. And we have a whole vision for Shady Grove. That's the farm is called Shady Grove Orchards, and we are gonna build, a big production kitchen, walkable gardens. We wanna do, like, a bathhouse and holistic retreat space, which my mom's already doing the panchakarmas out there, and so we have it kinda set up as a retreat as already, but just really trying to build it into something that's more of like an, um, you know, a community hub where people can come and reconnect to the land. And, I really want to also bridge that into like sharing knowledge and doing like teaching a little bit too. So the vision is kind of like people will come, we can like go out and collect the herbs, and then we can make it into something that we can use and take home and really take our power back and our independence back from reliance on, these big brands that are causing so much detriment to our health and our planet, and reconnecting and yeah,
Amazing. It's amazing. And so tell us about kind of we've talked before about your activism streak and you put together the Change Collective. So talk to us a little bit about some of that work that you're doing.
Yeah, so I've kind of gone through phases of my activism. Definitely like a fighter at heart. So
Uh-huh.
I've kinda gone through that of, like, being on the streets and organizing, and I've learned that it's just not sustainable, and so I've kind of transitioned my activism into something that's supportive for me, but also, like, just playing off my strengths, and I think my role in this revolution is to heal. I'm a healer, that's what I'm good at, and, just really helping to shift the mindset back to community, back to the land, back to holistic practices, paying attention to the environment and how we take care of the land and each other, and also just, like, cultivating joy and art and, like, having fun, and I think especially as a woman and a woman of color, it's like that's such a form of resistance. And in that, I'm like, feeding my own soul as well so that I can show up in my community as my whole self and better and make more change in that way. So I think my activism has kind of shifted more to those tangible everyday actions, and that's how I'm gonna change the world, and you can see that in, my brand and in my, my profession daily. And then as far as the Change Collective goes, that's the play, right? That's how I've been snowboarding for so long and competitively and, you know, done some films and worked with different snowboard brands. So it's really just it's building a community that's building the culture and kind of trying to shift the culture and change this sport that's very male white dominated into something that we all wanna be a part of. Yeah, so that's a kind of a slow burn. I think it's just we go on some trips, we kinda showcase our skills, we try to do support each other. It is really a collective. It's not like a official organization, it's a collective of athletes, and we are, just building community and supporting each other in that way because it can be kinda hard to find support in that industry. And so just showing up for each other. And that's, again, something that brings me a lot of joy and also creates change.
Yeah. Amazing. 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 And it is true that it is such a revolution for women to play and to play with our bodies in ways that are in the wilderness and that include strength and include capacity and drive. So
Mhm.
it's awesome. It's awesome. It's great. Great. And I love that, your mix is like your mix of skills and passions is really like you come from this place of activism and rootedness, and your interest is beauty and health. It's rare to find that combination in a person who understands beauty and health, who's working for beauty and health, and who's not driven by um, corporate wealth or driven by standard beauty standards, conventions. So you're welcome to our unicorn pastures. Some of the patients have come to call Nervata Health. When patients often come in, they meet one of us and they think, oh my God, I have to stick with you forever. There's no one like you. And then they start meeting the other practitioners here. And so there's been a few patients that have been starting to call us the unicorn pasture. So lots of rainbows. So I'm so happy to have you here at our clinic. I really, the treatment that you gave me yesterday was really fantastic, both kind of physically for my whole body as well as for my face and my mind. And so I would encourage our listeners, if you're local or if you're in Seattle, visiting Seattle, to come see Khai for either this relaxation piece, a facial, or kind of to do this deeper dive. And it is one of the things that we talk a lot about in Ayurveda and Chinese medicine. There's a big overlap that you really have to do these treatments recurrently as a series to gain that benefit because there is seasonal work and then there is daily work. And so, really working with you, I think, is going to be helpful for so many of our folks. Thank you. So,
Thank you. I'm really excited to be a part of what you've built here. It's so amazing. It feels so good just to be there. So
oh, thank you.
grateful and excited to get to know you and the other providers more.
Absolutely. Absolutely. And then let's start doing retreats, Nervata retreats.
Yep. Yeah.
Paper. Amazing.
We have a
Awesome.
space. We're building a space for it. So
I can't wait.
get into the woods.
Yes, get into the woods. Yes, absolutely. Absolutely. So, thank you, everybody that has joined today. We love that you've joined us to discuss how to make our whole world medicine. We rise or fall together and are committed to sharing knowledge and insight that empower us and our communities towards greater health. Thank you for listening to the Nervata podcast for complex health, and we will see you next time.